My name is Tony Holland. I am a psychiatrist from the UK, and until recently I worked at the University of Cambridge. And although I'm now retired, I hold an emeritus position there in the Department of Psychiatry. And I've been involved in research in the field of Prader-Willi syndrome as well as clinical practice for many years. The topic that I've been asked to address at the conference on this occasion is really improving mental health and well-being for people with Prader-Willi syndrome. And I think my experiences and talking to people and families throughout the world is that mental health and addressing issues relating to the various behavioral problems that affect people with Prader-Willi syndrome is probably very high on every family's agenda. It's an area that impacts on people's lives, and it certainly impacts on the lives of the families of people with Prader-Willi syndrome. So it's a real pleasure to try and address this issue. But what I want to do is something perhaps a little different than normally. And although my background is a medical one, and of course I see people with Prader-Willi syndrome when they're in crisis and try and address some of the mental health issues that arise, I think we should change the way we think about mental health and see mental health as a much broader issue than simply whether or not you have a mental disorder or whether or not you have a particular behavior. Because when you look at it this way, you have to address the things outside perhaps a rather narrow health perspective. You have to ask, what about support to that person with Prader-Willi syndrome? What about the support that the family is receiving? And you also have to ask, what are the opportunities available to that person with Prader-Willi syndrome? So if it's a child, what are the educational opportunities? If it's an adult, what about employment? What about leisure activities and so on? Because if we take this broad perspective on mental health, it requires all these different components. It certainly requires access to expert health clinicians, but it requires very good support, whether it's to the family or whether it's to the person with Prader-Willi syndrome who's moved away from the family. And one thing we know is that there's really an intimate link between health, quality of life, and quality of support. So in my talk, I want to address how we are beginning to understand some of the particular problems that impact on people's mental health, but I want to set it within this broader social family framework and draw very much upon work that is being done as part of the International Prader-Willi Syndrome Organization's initiative on mental health. And this has brought people together from across the world, and I think we've learned a lot from each other. So it is a great pleasure to come to the meeting. I have been to the IPWSO USA meeting on several occasions now. It's always extremely informative, it's friendly, it can be challenging, and this is exactly what one needs. I do think that the Prader-Willi community across the world is a very exciting and wonderful community to be involved in, and I wish to continue that involvement for the years to come. So I look forward very much to the meeting, to discussing these issues with you all, and hopefully contributing to how we might better think about the mental health needs of people with Prader-Willi syndrome.